Hello everyone, Surendra Kumar from Decoding the Indian Startup Stories. I host founders, entrepreneurs, young and experienced investors, and other stakeholders of the startup ecosystem. Today, I have with me Runam Mehta, CEO of HealthCube, who started as an entrepreneur at a very young age. Moving on to a corporate job, she exhibited her entrepreneurial skills and managed several positions in her tenure. She has spent over 14 years building businesses and new sales channels in the Indian healthcare industry. Hello, today I have an entrepreneur on my show. She was an entrepreneur, then she moved into corporate. She is in corporate. So welcome Runam to my show, Discovering the Indian Startup Stories.
Thank you. Thank you so much for having me, Surendra.
Great, it's my pleasure. Runam, I was just, wondering, at the age of 23, 24, you chose to be an entrepreneur. Why?
Honestly, Surendra, for me, it was not so much a choice as it was just where my life took me. So I'm trained to be a physiotherapist, right? I'm a medical professional by education. And I used to work, I had a clinic, I used to work. And then I used to see that there was one specific kind of a customer. 80% of my clients, of my patients had, they were all working professionals from banking, insurance, IT, and they had similar kind of problems, very preventable problems. And I was treating one person at a time, spending half an hour, 40 minutes with each of them. And I realized there is no way to really solve this problem in this, waiting for patients to walk into my clinic. So I said, let's flip it and let's take the solution to, where the problem is. I don't think at that age I really thought through, a business plan or coined any special fancy term of being an entrepreneur or anything of that sort. I just saw an opportunity and I realized that I wasn't solving it. I wasn't addressing it in the best possible way. So I decided to kind of take a leap of faith. I did everything myself. I made the website, I created the content, I made brochures. And I mean, now when I look back at them, it is all very, childish artwork probably, but I kind of put it all together myself. And then I went kind of cold calling, pitching. So I remember my first big client, I mean, we had a few small ones, but my first big client was BKT Tires. And the MD chairman said, it's just too expensive. It makes no sense. Why should I do this kind of a workshop, And I threw all the data at him and, he still wasn't convinced. So I said, okay, let me just do it for your top 20 people. And if they like it, you pay me. If they don't like it, if they don't think they'll benefit from me, you don't have to pay me. So he did that. He got his board actually and, the top leadership to show up, 25 of them. And at the end of it, not only did he pay me, but he gave me a recurring business for the next 6 months. Eventually, I did workshops for every single employee in that organization. So that was a huge break. And then, of course, I went on to work with Barclays, HDFC, some really, really big names in the banking and insurance industry in Mumbai. So, yeah. So long story short, I wasn't trying to be an entrepreneur. I was just addressing a need.
So can I call you an accidental entrepreneur?
I think, that might be more accurate at that age for sure. A lot of things that I did fell into place by accident.
No, to be honest, I think 90% of the entrepreneurs are accidental entrepreneurs, if you look at it. Particularly at that age, 23, 24, 25, just out of college, have great ideas, trying to do things all by yourself because money, B, you have plenty of time. So it is great. And so how long were you in that entrepreneurial stint?
So I did it for a few years, about 3 or 4 years. Eventually it grew bigger. I had more than I could handle. There were patients coming out of the spin-off. So then I had some consultants who I started kind of giving business away, to make sure that the need is met. And I think when you're very, very young, you're not very greedy. So it wasn't really about, how much money can I make? It was about how many people can you really impact. When I moved to Bangalore is actually when I kind of, again, accidentally, but changed tack. So I think for a good 4 or 5 years, we ran it very successfully.
Okay, so you had a successful exit, as they call it in the new age terms.
Yeah, I mean, it was a profitable business. And
Okay.
at a certain point, I decided to join a company, which meant I had to shut down my business. That's
Okay.
basically a choice I made.
So which is the second stint? Just to understand, you started your entrepreneurship journey in where? In Mumbai?
Yes, in Mumbai.
Okay. And then you moved to Bangalore.
I moved to Bangalore a decade back after I got married. And I actually got a very good break in Britannia as well after I moved to Bangalore. But I happened upon Portea accidentally, and they were trying to disrupt the home healthcare market. They were looking to hire someone from the physiotherapy or a medical background to really help shape the business that they wanted to grow. And, there was an obvious conflict of interest. I could only do one or the other. I couldn't have done both. So at that point, I chose to join Portea and help them to grow the physiotherapy vertical. Eventually, I stayed with Portea for 7 years, Surendra, and I think it was the best 7 years of my life career-wise. A lot of the things that I did in my first venture, I was stumbling around, figuring it out, making a lot of mistakes, of course. But when I was in Portea, I had the guidance of Vaibhav Meena Ganesh. So a lot of structure, a lot of, reasoning of, why you're doing what you're doing. What are the things you want to be measuring? How do you track, stuff really? And why that is important to do. Making the system work with you, right? Because it's no longer about you. You have to get, 5 different departments to kind of buy in to your way of doing things and then pull it all together.
You can say there's a process. You learned a process.
It's a process. Yes. In fact, if you create a process, you have to do something, you have to prove that it works, and then you have to create an SOP so that others who come after you can continue to run the business and not really, collapse.
Yeah, or reinvent the wheel, as they say.
Or reinvent the wheel. So while I was in Portea for 7 years, I held 5 or 6 different roles. I was very fortunate. They gave me a lot of opportunities. I ran 5 or 6 different business verticals. I did the B2B strategy piece for them for a couple of years. When I exited Portea 7 years later, I was head of strategic initiatives. And what that really meant is that anything that was new or broken would come my way. So I would either set up new businesses, or I would look at the businesses that perhaps weren't really meeting all the objectives and find ways to make it work or shut it down, right? One or the other. So that's really what I did for 7 years and exited Portea.
So this is what we call it entrepreneurship. You were an entrepreneur in Portea.
Absolutely right. I was exactly that. I was the entrepreneurial blood, so to speak, unleashed within the company to, kind of work on different business problems.
So let's talk about this entrepreneurship. It's an interesting subject. It is a new culture which companies in India need to develop, or already they have developed, but majority has to adapt. So what do you say about it? What do you tell the people? Okay, people who want to decide upon career or entrepreneurship, or they are in between. So there's something called entrepreneurship, because from your experience being an entrepreneur, then moving into corporate. So what is your take on that?
Okay, so let me try and answer this the best way I can. I think entrepreneurship is something that's in your blood sometimes, right? You may be running your own business, or what I did with Portea was I ran a business for somebody else. I was kind of a salaried employee, but I was still the entrepreneur. I was still wearing the founder's hat, so to speak. I was still thinking about what are the real problems that I can solve to make a business successful. Who's my customer? What does he need? How am I addressing this need, and how am I not addressing? What are my limitations as a business, as an organization? Is this something I'm willing to change or not change? So in my opinion, there are 2 kinds of people in any organization, right? There are people who replicate really well, who do what they do day in and day out, perfectly well, and they'll keep improving it. And, incremental changes, incremental improvements will continue to happen. And you really need these people to keep any organization running, right? So these are probably the 4 wheels of a car. They have to keep turning, otherwise you're not getting anywhere. But you also need the disruptors within organization, or what you're calling the entrepreneurs, who are looking at what is working and saying, can I change the direction a little bit? And will that make a difference? Right? So to speak, a sort of a steering wheel, which says, okay, we're going on this path, we're doing a great job, but is this really the path we want to be on? Is there a way to be on an easier path, or a path that's growing faster, or solving a more important problem, whatever it may be? And then entrepreneur has to make sure that the four wheels of the car actually turn with him. He himself can do nothing, right? He can only provide the direction, but he has to also have the ability to get these other departments to kind of move along with him on the different journey that he wants to undertake to make it successful. Or he has to say, this is not working. And no matter what I do, no matter how much I stir the ship, it's not going to work. And then it's for the organization to decide whether or not, it's worth spending more petrol in that direction.
Okay, now it's good. It's interesting, because today we are talking about entrepreneurship and entrepreneurship. So now, when you said that, okay, in an organization, being an entrepreneur, okay, you are the steering wheel, and there are some people who does the same systems day in and day out, and they're the wheels of the vehicle. Now, when you look at an entrepreneur by himself, in most of the scenario, he is a steering wheel and he is the wheel. Am I right?
Absolutely. Absolutely. Especially solopreneurs.
Solopreneurs, yeah. I think most of them are solopreneurs in that entrepreneurial category. Great. And so, do you think it gave you a comfort level moving from an entrepreneurship role to an entrepreneurship role in Portea?
I think, honestly, I was hired because I was an entrepreneur.
Great.
And I was certainly promoted multiple times over because of being an entrepreneur. I think the one thing that set me apart within that system, or even in the system that I'm currently in, is the enterprising, nature, which comes with being an entrepreneur or an entrepreneurial person. See, you may not run your own business. There are people who, due to multiple limitations, cannot really, put in their money or do without that monthly security. But they can still be entrepreneurial in nature. And in the right system, which really unleashes their creativity or their business acumen, I think they can really do wonders for themselves and the organization.
Runam, I really like it. This is a very clear and good message to all those entrepreneurs or would-be entrepreneurs, saying that, hey, you can be an entrepreneur, you can go the mile, whatever you want, but then one day you decide saying, it's enough of an entrepreneurship, but I do have my entrepreneurship blood in me. I can work for somebody and be a very good entrepreneur and make sure that I help the organization, and as if it is my own company. It's a great message, Runam. It's a great message. And now moving on, how long were you in Portea? 7 years, you said.
7 years, yes.
Okay. And from then, where did you move?
I actually joined HealthCube about 1.5 years ago to head sales. I have never done a pure play sales role in Portea in my life, but I think all roles are sales roles. Sales skills are life skills. So I joined HealthCube to head growth. I was here for about 6 months when the board voted me in to become the professional CEO for the organization. So a lot of people, when they see that I'm the CEO, they assume that I'm also the founder. I'm not. We have a different founder, but he's entrusted me with leading the organization. I think it's been about a year to the date now since I took this on.
Great. And how do you find, because you mentioned about sales, because sales is an integral part of anybody, be it a parent, be it a son, be it a teacher, be it anybody, sales is an integral part. So how do you find, doing a sales job after your entrepreneurial role and entrepreneurial role, when you were given a sales job? How did you find it?
Honestly, to me, Surendra, the way I approach any role remains the same, right? It doesn't matter whether I'm looking at only one vertical or I'm looking at the entire business. Finally, the salesperson's job is not to just close a deal. It's to find the right customer, for whom you're really solving the right problem. ensure that the customer sees the value in your product, and finally establishing a long-term relationship with the customer. So I'll give you an example. I could probably sell something to you, but if it doesn't really fulfill a need, you're never going to use that product. You're never going to come back to me. And while on paper I have done my job as a salesperson, I don't believe I've really done justice to my business, right? Because I've basically made a fake sale. I call these fake sales. They have no meaning in my book. So I only looked at this role also as the business owner and not just as someone who has to bring in X amount of sales, tick, 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 and be done with it. That's how I have trained the entire team in HealthCube. They've been with me for 1.5 years now. And I think our sales team has the lowest churn rate in the entire organization, or that I have actually heard of anywhere, because I train them to think about everything from a business, from a P&L, from a long-term LTV perspective. I think it just makes the entire sales organization a lot more integral and a lot more well integrated with the rest of the system. They're not just running around meeting their own objectives while the rest of the company is off doing something else.
Yeah, basically understanding how a company works. When you say you're talking about P&L, the responsibility, shared responsibility, accountability, everything comes into place. Because if people, as you say, salespeople, they do just the sales job, then 99%, as you said, it's not the real sale they do. Because pushing and making people buy, or people coming to you for buying, there are two different things. So can you explain to me or tell me about HealthCube and what exactly HealthCube does?
Absolutely, I'd love to. So we are, in a very simple manner, we are a diagnostic device manufacturer. We have created a small device. It is as big as a set-top box, and it does 30 tests. It does vitals, it does your basic biochemistry, which is your blood sugar, cholesterol, hemoglobin, and it also does a huge panel of infectious diseases like malaria, dengue, chikungunya. Let me tell you a couple of use cases. I think that tells the story better. So imagine you're sitting in Chhattisgarh, or Nagaland, or Myanmar, or somewhere, right? And a patient walks in, and he has a high fever with chills. Now, for the doctor looking at this patient, he knows that either this person has malaria, dengue, chikungunya. These are 3-4 things. But in this place, this is not a Mumbai or a Bangalore or a Delhi, right? Here, the phlebotomist is not going to turn up to this person's house in the next 2 hours to take his blood, right? A blood draw with a blood report coming in will take a minimum of 2, possibly 3 days. Now, what will the doctor do for those 3 days? Either he cannot give you any treatment. He will only give you your,
paracetamol or...
Right, just symptomatic treatment and wait for the report to come in. Or in some cases, if the condition is very bad, they may take a judgment call and choose to start 1 or 2 diseases, antivirals or antiparasitics. But the problem is that if you've given either double the medicine or the wrong medicine, the patient is not being helped and the side effects are, of course, happening. Both of these situations are suboptimal. Our machine will actually tell you whether he has dengue, malaria, chikungunya, syphilis, or some other infectious disease in 20 minutes. Right? Now, similarly, there is a maternal use case because we've integrated with a fetal Doppler. So, pregnant women in these kind of areas, they work. Most of them are farmers, some of them are laborers. They work all the way till they deliver. They don't stop working because they are daily wage earners. And they obviously neither have the time nor the resources nor the education to understand the importance of antenatal care, right? So it is impossible to detect high-risk pregnancies. It leads to higher maternal and child mortality. But if these kind of machines, our kind of machines, are available in PHCs everywhere, or even smaller sub-centers everywhere, high-risk maternal cases can be detected, can be monitored, and can receive the correct treatment well in time to save that poor young woman and her child's lives. So there are multiple use cases. I mean, to talk about another one, a patient with cardiac symptoms. Now, heartburn and cardiac symptoms are often misunderstood.
Correct.
By the patient himself, and sometimes if, the medical practitioner is a nurse or, is not a very experienced doctor, it comes very, very similarly. We have a 12-lead ECG, which is accurate, and we have cardiac inflammatory markers in the device. So both of these put together can indicate whether the patient is possibly having a heart attack and send him to a tertiary center very quickly rather than spending a couple of days waiting for the person to have more severe consequences. So there are multiple use cases for a device. It has been designed for remote and rural use, Surendra. It does not require internet. It does not require electricity. So in a country like ours,
it doesn't require electricity. So it's battery powered?
It works on a power bank.
Power bank.
Yes. So in a country like ours, where we know the infrastructural problems, we know internet is shady, even in the top cities in the country. We know electricity, power outages happen regularly. The machine, once it is in a subcenter, will continue to support the subcenter irrespective of the infrastructural hindrances.
So you mean it's a standalone machine?
It's a standalone machine. We have the ability to integrate with other manufacturers. We have done a lot of integrations, but basically it's a standalone machine.
It's a standalone machine. And so this is your main product or the product, or there are other products also?
There are other products, but this is the flagship product. This is
the flagship.
Most important one.
And being from the healthcare industry, what do you, how do you look at maybe the next 10, 20, 30 years of the market for healthcare in India?
Okay, that was a very interesting question. There are many ways of looking and answering from a consumer perspective, from a health perspective. I think healthcare industry is finally starting to understand that we need to restructure the way we have kind of formed over the years. I think this is one of the only industries that is centered around the expert and not around the consumer. You think about it, take a minute to think about how any other industry is.
Correct.
Whether it is real estate, whether it is retail, whether it is e-commerce, everything, customer is always at the center. And then everything else gets designed.
Revolves around it, yeah.
In healthcare, it is the specialist or the doctor who is at the center. And the patient is revolving around it.
Correct.
And this is not correct, neither is it sustainable. Right? Because people are becoming more aware. People are becoming more savvy. Consumer will demand, 20 years, 30 years, 40 years down the line, consumer will demand a different kind of care than what is being provided today. There is a place for tertiary care centers, right? An operation cannot happen in your home. But more and more of the services, healthcare services now, have to move to the consumer and think about consumer at the center. You cannot have an organization stand alone and say, this is what I do. Now, when you need something else, you please go to XYZ. Over time, the organizations that will do well will be the ones who will say, this is my customer. These are his 5, 7, 10, 20 needs. And this is how I am going to fulfill all of them. An example would be Apollo. Right? They're primarily a hospital chain. But if you look at what they're doing, they're trying to provide a lot of the services in different ways to the consumer, thinking about the consumer's needs first. And perhaps over the next 20 years, a lot more of the serious players will start to change their approach. So that, I think, is one thing that will definitely happen. The second change that I at least hope to see is a lot more pocket spend, pocket share, mind share being spent on preventative devices rather than, curative ones. And when I say devices, I don't just mean like devices in medical devices, but, whether it's applications, whether it is services, whether it is preventative health checks, screening. I hope the government, the private, and mainly the consumer will start understanding the importance of, spending proactively time, money, and resources on understanding what could go wrong and taking steps to prevent it. So that's the second thing I hope to see change. For the entrepreneurs out there, I think healthcare is the space to be because change is imminent. And a lot of the budding, smart, intelligent people out there today can actually be harbingers of that change, right? What we saw, with technology 20 years ago, what we are seeing with e-commerce disrupting how we shop, disrupting how we eat food, disrupting, how we receive our groceries. Today, I think a decade from now, healthcare delivery is going to look very, very different. And we need the people who are going to bring about that change.
Great, Runam. You really touched upon the various, factors which is going to influence the healthcare industry in the coming decades. One of the major initiatives, I think, with the government of India is ABHA. I think ABHA is also going to play a major role, and I think integration is going to happen starting from tertiary level to the super specialist. And I think the COVID era has also taught us or thrown open so many opportunities and challenges to the healthcare industry.
Absolutely. No, you're absolutely right. I think what COVID did was it ripped away the bandage, right? Yeah. We all knew there's a problem. We knew there's a wound, but there was a Band-Aid and it was working. But COVID came along, ripped away the Band-Aid. We are forced to, see the exposed wound, which is the healthcare delivery system in India today, especially for bulk of the country, barring the top maybe 10, 20 cities. And, we have to address it. And I believe this government is taking steps. At least they're talking the right talk. They're talking about bringing technology, bringing data into play. They're talking about boosting infrastructure. So I think the conversations are going in the right direction. Proof of the pudding is always, it's always going to be in the execution, in the implementation. Yeah. And we will watch it for the next 10 years and see how much of the change, really impacts the last mile person. But you're right. I think COVID is the catalyst for this, yes.
Excellent. It was a great conversation with you, Runam. You really opened up and say, from being an entrepreneur to an intrapreneur. So this is a main takeaway for me or for the people on today's discussion is, yes, you can be an entrepreneur and you can be an intrapreneur with the same spirit in a company and drive it forward. I think a country like India will need entrepreneurs as well as intrapreneurs because majority of the corporations, majority of the organizations are lacking entrepreneurship. And the companies also has to encourage entrepreneurship. It's two sides of the same coin. Okay, you can have entrepreneurs, but you need the management, you need the people to have that kind of a mindset saying, hey, it's better to have an entrepreneur rather than having, XYZ. So it is great. And we spoke about the healthcare industry. You threw light upon it, and definitely there's a lot of works and challenges ahead. Pleasure to have you on my show and hope to see you soon and have a nice day.
Thank you so much. It was a pleasure to talk to you as well.